There are many causes of neuropathy that can be halted or reversed if you can identify the underlying cause. Today we're talking about some essential screening that can see if you have one of these reversible causes of neuropathy that may help to prevent worsening of your symptoms. My name is Dr. Brian Kaiser. I'm a board-certified neurologist here from Dr. Neuromatters. This channel is dedicated to all things related to the nervous system. If you have any specific neurologic matters you'd like to hear about, please let me know in the comments below. Now, burning feet is one of the most classic symptoms of a peripheral polyneuropathy. Peripheral meaning peripheral nervous system, polyneuropathy literally meaning many nerves suffering. This affects around 20 million people in the United States and tends to affect those longest nerves, those furthest from the spinal cord first, and so symptoms typically begin in somebody's toes and the ball of their foot. And the distribution is so classic in the world of medicine, we call it a stocking glove distribution. So how do we establish a diagnosis of a polyneuropathy? Most people's journey starts with their primary care physician, and they'll typically get a history and physical examination, testing things like sensation and reflexes. I think the biggest goal is to look for red flags, something that may suggest an alternative diagnosis than a traditional painful polyneuropathy. But with their history and examination, their goal is to kind of start to whittle down and see what the most likely causes of your neuropathy might be. And so I think it's important in having that relationship to make sure that you're disclosing things like history of drugs, alcohol, sexually transmitted diseases, because these are relevant in the context of a painful polyneuropathy. Now, that initial assessment is going to yield the diagnosis of polyneuropathy in the majority of cases. However, if your primary care provider finds red flags, you can be referred for additional testing, imaging of your spinal cord, of your neck, of your back, and even some dedicated testing for neuropathy, such as electrodiagnostic testing. This is usually performed by a neurologist or a PM&R, physical medicine and rehabilitation specialist, but just so you know, this is not required for the diagnosis. Now, if you need that, the EMG can identify the severity of the nerve injury, the distribution and location of the nerve dysfunction. But really, once a diagnosis of polyneuropathy is established, we need to answer that why question. Why are your nerves being injured? Before we go on, though, if you're new to this channel, I hope you'd consider liking, subscribing, zap that subscribe button and bell notifications to stay up to date. Now, as I mentioned before, diabetes is the leading cause of a painful polyneuropathy. So we definitely need to get some testing for oral glucose tolerance testing or hemoglobin A1C. But in addition to this testing, the American Academy of Neurology recommends that people have thyroid screening done by checking a TSH, check your vitamin B12 level and its metabolites, MMA and homocysteine. And the reason that we check these metabolites, it increases our yield of detecting diabetes. Additionally, you can check folate, ESR, immunofixation, and serum protein electrophoresis. Now, your primary care can order these tests for most of you. However, if you prefer to guide your own care, I've included some links to a walk-in lab that are below. Because that's convenient and many people prefer to direct their care that way. Now, there are so many causes of neuropathy that this small list is not comprehensive. Now, if these tests don't yield an answer for you, I think it's worthwhile pulling up this list that I've included below from the American Academy of Neurology for other causes of neuropathy and review these with your primary care physician to see if it makes sense for you to check these additional tests. Now, ultimately, if you identify the why behind your neuropathy, you can then target interventions to really optimize the internal environment of your body. And so the best example of that would be you've got diabetes. And so how do you better control your diabetes? You do things like eat the right foods, make sure you're exercising regularly, take your insulin or other medications to lower your blood sugars. If you find that you've got a B12 deficiency, take a B12 supplement or do hormone supplements, whatever it may be. But I think if you can optimize the internal environment of the body, you're going to help to prevent additional nerve injury. We call these reversible causes of neuropathy. So really important, again, to try to understand the why. But I do want to point out that around 50% of people, despite comprehensive testing, even going to see a neurologist, you may not come up with a cause. So I think there's where the highlight comes in. I think regardless of the mechanism, good to identify what those specific causes are for you. But I think everybody, even if they don't have a specific cause for you, needs to target vascular risk factors. What I mean by that is control things like blood pressure, cholesterol, diabetes, stop smoking, stop drinking, participate in regular exercise. And those are probably the best things that we can do for you. Now, if you found this information helpful, hope you'd please consider staying around and checking out some of my associated videos. Again, this is Dr. Brian Kaiser, where neuro matters.